telephone audio yet, but she's starting to get on here. So again, I want to welcome any of you who are joining this call and who aren't part of the 7 projects. Just to kind of explain while we're going forward here, Health Ministry Fund has had 12 young children's mental health projects, which have a primary goal of developing universal screening for young children 0 to 6 for the ASQ SE, and a secondary goal of developing more Edinburgh depression screenings in their area. And then they sometimes have further work they do around just developing resources in the mental health centers and early child care centers and so forth to deal with social emotional issues that are the results of those screenings or otherwise need attention. So we've been hearing from 6 of the existing 7 projects already this morning, and we'll break here to do the Brookes presentation just shortly. Amy, we expect more to be joining us, so we're going to hold up just a little bit till a little bit after 10, I think, as we let people get on here. But
great, that sounds fine, thanks.
All right, you can hear us okay, it sounds
yeah,
like.
I can hear you. Can you hear me okay?
We're doing good, and can you see your PowerPoint up there on the screen?
Yes, I can, thank you.
All right. Well, I'm going to let Katie take back over. I was just going to do an interlude there while we're kind of getting people on to indicate. Any of you who are joining us are welcome to stay on the call after the Brookes presentation. We want to invite anybody joining us to participate on a regular basis with this learning community, where we will hear reports from these projects, but we'll also bring other resources and other opportunities to discuss issues in young children's social emotional health. So if you're not part of our group already and want to join us, I'd encourage you just to email Katie Ross, kross@healthfund.org. Let us get you on the mailing list. And we do these meetings quarterly. Every other session's in person here in Hutchinson. And then we have the webinar sessions in between. So our hope is to make contact with many more people who care about young children and their social emotional health as we continue to work forward to build a better culture of support for that part of child development. So it looks like several are joining us, Amy. They're going to want to hear from you, apparently.
That's great.
We do appreciate you and Brookes doing this with us and for us today. Thank you so much.
Oh, we're thrilled to be on. We know that Kansas, they're big users of ASQSD, and we're really excited about the 2nd edition and to share some information about it.
Great. Well, you know, change always creates a little trepidation, so we thought maybe a presentation by you would reduce that level of concern and help us see it as an opportunity. So that's what our goal is today. So.
Sure. Yes, I understand. Yeah, the transition should be a pretty easy one. So once I walk through the questionnaires, I think people will feel better about it. It'll feel very familiar.
Good. Well, just for everyone who's joined us, thank you all. We really appreciate you taking the time. And again, we're thrilled to have Brookes Publishing with us. I'm Katie Ross, and we have our staff, a lot of staff with us here from the Health Ministry Fund. So Kim Moore, our president, you just heard him speaking. And then we have Aaron here with us as well, who is our vice president. And then Jeff, who is our IT person. So thankfully, he's here to help us with any questions. Just so you're aware, we will start muting the lines now so that we don't get any feedback for Amy as she's doing her presentation. But use that chat box down below, and I will interrupt with questions at that point if we need them answered during the presentation. Amy told me that it was okay to interrupt her. So if not, we will leave some time at the end for your questions. For those who are grantees or part of our projects, I did send you a couple of handouts that Amy was kind enough to share with us. And then also, I think that for those of you who are part of the other group that's on the call, Betsy Thompson should have sent those out yesterday, possibly, or this morning. If you didn't receive those, please feel free to contact me later. So with that, I'm going to go ahead and get us
Katie?
We are recording, yes.
Katie,
yes.
this is Sam Schisler. I just wanted to let you know that I've joined the webinar as well.
Great, thank you, Sam. We really appreciate you joining. And I did see that Carolyn Burke, is on the call as well. Thank you, Carolyn, for joining us too. So we really appreciate all three of you. Sam was kind enough to help coordinate this and get Amy on the call for us. So we're thrilled. We think this will be really valuable for everyone. And as Amy said, this has been something that many in Kansas are utilizing. And so to decrease trepidation around this, we do hope that this will help. So with that, I'm going to go ahead and turn it over to Amy for her to get started on the presentation. And again, please feel free to use that chat box for questions that you have during the time. Oh, and we are recording, just so you're aware. Sorry.
Great, thanks. I'm Amy Perkins, and I'm Perkins Clause, and I am the marketing manager for ASQ here at Brookes. So I've worked on ASQ for about 6 years now. So I'm happy to share some information about ASQ SE2. We're all really excited about the second edition coming out. As Katie mentioned, Sam Schisler is the sales consultant for Kansas, so he can help out and answer any questions. And Carolyn Burke is our professional development manager. So she handles all of the trainings and the Brookes on Location seminars for ASQ and our other products. So I think Katie, there we go. Just making sure I could move the slides. So the purpose today is kind of just to describe the second edition for everyone. I'm going to highlight some new changes and new features. There's also a couple of important implementation changes, so I wanted to go over those. And then you'll see some samples of the new questionnaire, and then we'll have a Q&A at the end. And please, as Katie mentioned, feel free to type in questions to the chat box, and I'm happy to be interrupted at any point. I will say the ASQ SE2 products are arriving at our warehouse as we speak, so they should be starting to ship next week. So by the end of next week or the week of September 14th, people who've pre-ordered should have them in hand. I think that would be a very exciting day for everyone. It's been many years in the making. So I think most of you on this call are really familiar with ASQ SE. So this is just a brief overview slide. You'll see pictures of the new boxes. It's a parent-completed questionnaire, and it reliably screens young children for social and emotional difficulties. It screens the same 7 areas as the first edition: self-regulation, compliance, adapted functioning, autonomy, affect, social communication, and interaction with others. The features are very similar to the last edition. There are 9 questionnaires now, so one change is the addition of a 2-month questionnaire, which is really exciting, so people can start screening kids as young as 1 month. Each questionnaire has 19 to 39 items. The younger questionnaires have fewer items. It's designed to be completed by parents or family members, and teachers and caregivers, if they spend at least 15 to 20 hours a week with the child, can fill them out. And the questionnaires are available in English and Spanish, and both of those will be available next week to start shipping. So just like the previous edition, ASQ SE2 has both competence and problem behaviors. So you'll see some examples on your screen there. So because ASQ SE is measuring both of these behaviors, that's why the scoring changes. So sometimes the positive response is worth 10 points because it's a behavior that you don't want to see the child do, but sometimes it's a behavior that you do want to see the child do. For example, does your child greet or say hello to familiar adults is a competence behavior, so you do want to see the kid do that behavior, so it's 0 points when it's a positive. So I know the scoring's always been a bit confusing for people, and so we tried to put some features onto the new questionnaires to help a little bit with scoring, but it's the same competence and behavior problems on the second edition. Just like last edition, that's what causes the questions to switch scores. Externalizing and internalizing behaviors are both covered. So there's things that, behaviors that you see the child doing externally to other people or animals or other children, and sometimes they're internalizing behaviors for the child. So this is just the slide has a quick overview of all of the changes, and we're going to go over all of these different changes. So as you'll see, there's definitely lots of reason to switch to the second edition. There's been lots of improvements. The 2-month questionnaire is one of the most visible changes. This was added a lot at the request of a lot of users who really wanted to screen kids all the way, as soon as they could at 1 month. There's a picture up on the screen, and some of the sample items, or when you talk to your baby, does he look at you and seem to listen? There's 16 scored items and then 3 overall questions. The overall questions at the end are the ones that ask about general concern, and the last question on every questionnaire is always, what do you enjoy most about your child? And that was a feature we kept from the first edition. There's an expanded age range. So with the addition of the younger questionnaire, it starts at 1 month, and then the 60-month questionnaire has been, it was normed, so it goes up to 72 months. So there's an extra 6 months at the end, so you can screen a kid all the way through when they start school. So this really helps facilitate monitoring children from birth all the way up to kindergarten. There aren't any gaps between the questionnaires, so at any point in that age range, there's always a questionnaire you can use to screen a child. There are, of course, new cutoff scores. There was a really large standardization study that was over 14,000 kids. More than 16,000 questionnaires were completed and analyzed to do the renorming. And the sample, the authors tried really hard to make sure that they were collecting a representative sample, and it mirrors the U.S. population in terms of race and ethnicity and all socioeconomic groups. And because of the new renorming, there's all new cutoff scores for all the questionnaires. This is some information about the technical data. ASQ SE2 has really excellent reliability and validity, sensitivity, and specificity. And the technical report that's in the appendix of the user's guide goes over all of this. And we hope to have that available on our website probably within another week. We're going to have the whole technical report up there. The monitoring zone is another exciting new change. For those of you who are familiar with ASQ 3, we added a monitoring zone when that published in 2009. And so we added one with this new addition just to help with score interpretation and to help providers make some decisions about follow-up. It includes, so the monitoring zone is the bottom end of the monitoring zone is the 65th percentile when they were doing the norming. And so the scores, kids who are close to the cutoff are going to fall into that monitoring zone. And then there's some guidance in the user's guide to talk about what you can do with those children, whether you follow them more closely, provide them with activities. You might want to rescreen them sooner than you would a child who fell into the no risk area. One thing that the authors noted about the monitoring zone, and this is all outlined in the user's guide. So one thing when you're interpreting the results, there's a difference between boys and girls in the monitoring zone. So if the authors recommend that if it's a girl, if you're screening a girl and her score falls into the monitoring zone, they want to consider a referral. And that's because when they did the normating sample, in general, girls' scores were lower than boys. So if it's a girl and she's falling into that watch zone, it's really higher, I guess, than if it was a boy who had the exact same score. And I think part of that's because girls tend to have more internalizing behaviors than externalizing behaviors, so sometimes they're not as visible to people. And so all that information is described in Chapter 6 of the user's guide, and also in the technical report. There's a lot of tables that talk about the difference between the gender differences they saw. But that's one implementation change and something to consider when you're interpreting results with this edition. So we added a lot of behavior and communication items. There's 16 new items that were added, about 3 to 7 per questionnaire. And these were designed to elicit parent concerns that could point to autism or early communication issues. They focus on red flag behaviors, such as reciprocity, smiling, and eye contact. There's an example, 2 examples up there on your screen. In the technical report that's with the ASQ SE2 user's guide, the authors talk about a study they did with 133 kids who were diagnosed with autism spectrum disorders, and they families complete ASQ SE2 questionnaires, and they found that there was 83.5% agreement between the risk classification on the ASQ SE2 and the autism spectrum classification. So these preliminary analyses suggest that ASQ SE2 will identify the majority of kids who have autism spectrum disorders. There's a table, table C12 in the user's guide, lists all the items that are the items that were added that deal with autism spectrum behaviors. The authors are currently working on doing new studies with kids with autism and ASQ SE2, but for now, the authors, just the preliminary work suggests that if you screen a kid with ASQ SE2, the majority of them are going to be identified as having a social or emotional concern on the ASQ SE2. And there might be more questions on that, so I'm happy to answer during the Q&A at the end. So some of the changes we made were refining items. These were based on user feedback. So we tried to do more clear wording and more examples. So you'll see an example up on your screen that we added for ASQ SE2. We added that second sentence just to give parents an example to make sure we're getting the most accurate result. We also changed the response options. This was also based on research and user feedback. So the positive response option, you'll see in the second box, it used to be most of the time, and then if you follow that arrow down, now it's often or always. So sometimes parents had problems with some of the questions. There's an example, does your baby laugh or smile at you? Another question that's a good item for this is, does your baby cry, scream, or have tantrums for long periods of time? Well, the parent might get confused. So they might not have tantrums most of the time, but they might have them often. So we decided after doing research that switching that positive response would help clarify to parents and make it more clear of what response is really the best option, so we can make sure that the item's getting scored appropriately. So there's a revised Spanish translation. It reflects all the changes made to the English version. It has the same cutoffs as the English version. The translation was reviewed by a group of experts, and this new translation is more appropriate for a broader Spanish-speaking audience than the first edition was. So we think it should serve the needs of the Spanish-speaking population here in the U.S. very well. This slide on your screen now talks about an exciting new addition that we added, and we're really looking forward to hearing some feedback on this. So as you start using the new addition, please feel free to share how you like this new feature. So we've added optional sheets for recording responses. So you may, if you're familiar with ASQ3, on that scoring sheet there's a little grid where you can record the responses. So for ASQ SE2, because the questions are, the responses alternate, so it's not as clear to know whether the response is good or bad. So these item response sheets, which I can forward real quick to the next slide, they're abbreviated versions of the questions, and then there's a column where you can add the parent's response and then any comments. So this is just designed to serve as a record. It's optional. They're included on the CD-ROM. There's one for each questionnaire, and so you can use it if you decide you want to return the questionnaire pages to the parent. You can fill out this optional recording response sheet, and then you'll have a record of what the responses were. You also might want to share it if you want to do a referral to a mental health specialist or a psychologist. You might just want to send them the response sheet so they can just see that in a quick way. So these are optional, and they're on the CD-ROM, so they do have to be printed. If you're photocopying, you will have to print these separately. But we are really looking forward to hearing how people like these. And in the handout that I provided, we did include the item response sheet, so you can see a full one on your handout. So the parents' engagement materials are also new for the second edition. These are very similar to the materials that are provided with ASQ3. They are included in the user's guide for photocopying, and then they're also on the CD-ROM that comes with the questionnaire boxes. There's a What is ASQ SE2 parent handout that you can give out when you give the questionnaire for the first time, or every time, and there's a parent conference sheet that you can use to guide your discussion when you share results with the families, and these are available in both English and Spanish. There's also revised development guides and activities. These were in the first edition, but these have been revised, and then we added in a younger version so we could capture the 2-month-old babies. And these are also both in English and Spanish. They're in your user's guide, and also on the CD-ROM in the questionnaire boxes. There is a all-new updated design, so it looks very different from ASQ SE first edition, but it looks very similar to ASQ 3, if you're familiar. We did that intentionally to help, so a lot of people use both tools together, and we thought having a comparable design would make them easier to use and also more familiar feeling to parents. The second edition materials are in black and white. There aren't any different color pages, and that was to make photocopying easier. Some of the ink on the first edition questionnaires didn't show up that well always when it was photocopied. The box for ASQ SE2 is going to look a lot like the ASQ 3 box. It's going to have a handle. There'll be tab dividers. And then I'm going to go over some quick layout changes that we've added to help support implementation and scoring. So all of these changes are outlined on that handout. If I can change, I'm not sure if that's showing up on your screen or not, but this is what the handout, we compiled a handout with a list of all the changes, and then as you flip through, we highlighted on the actual questionnaire and used numbers to note what the change was. So hopefully that'll be helpful. So one of the first things we did was we made the age range really prominent. That way, we know choosing the questionnaire is like the first important step you have to do to make sure that you're giving the child the parents the right questionnaire. So we made it really visible. It's on both the family information sheet and then also on the questionnaire first page. We moved the instructions. So the instructions on the first edition used to be on a separate page, and we heard that that was problematic for photocopying reasons. Sometimes programs didn't have the budget to photocopy an extra piece of paper. So the instructions were added to the top of the first page. That way you can ensure that every parent's getting them questions, the instructions, and it's very clear when they're starting. They can look over before they get to number 1. They can read what they're supposed to do. So this is a change we made to help with scoring. So you'll see I've zoomed in here. On the left is a questionnaire page, and then I zoomed into the concern column, and so the parent's supposed to check the little circle if there's a concern. Well, we added a small V beside the concern to help remind people that whenever a parent checks a concern, you're supposed to add 5 additional points. So this is designed to help make sure that scoring is accurate. And there also are those small numbers also are next to the other responses, the X, the V, and the Z, as they were in the first edition. We added scoring lines. The first edition used to just have a line at the bottom where you just added, in your head, you kind of added all of the items and tallied them at the bottom. But we actually added a scoring line beside each item. So you can score each item individually and then add up the row of numbers. And hopefully that'll make scoring a little easier. We made a lot of adjustments to the information summary sheet, which is the scoring sheet, the final page. The first box is a little grid that shows you where you can add up all of the scores from each individual page. Then you'll see the second box there is that's the scoring line, which shows the monitoring zone, and so we added that just to be a visual interpretation of results. So you can see the cutoff score is listed above, but that it's also marked on that scoring line, and you can see where the monitoring zone is. The next box, it's an area to record concerns. So there's three questions there at the back that ask about general concerns. You can record the responses. And then the first item, let me see if I can switch on the handout to show you. This first item right here, if you can see it at the top, right under the 15, it says 1 to 31, any concerns marked on actual items. So if a parent marked a concern on the item, you can note it on that information summary sheet. Say like, okay, number 6, they had a concern. So we might want to look into that more. The next box down here is about follow-up referral considerations. So it just talks about the different things you can consider as you're interpreting the results. You know, are there environmental factors that might be affecting how the parent responded? Are there any health factors? Is there something going on in the child's life that's, you know, that could be affecting their social-emotional behavior? And so you want to, just some factors to consider before you, you know, make your final decision about what to do after the screening. And then the following box was something we added on ASQ 3, and we got really great feedback on. It's an area to record the follow-up options. So you can decide, so if you're going to refer the kid for a more in-depth mental health evaluation, you could mark that down. If you're going to share the results with the pediatrician, you can mark that down. If you're going to ask maybe the teacher to complete a ASQ SE questionnaire to see how the child behaves in her class, you can mark that down. So it's just a kind of a place to help make sure, track with like what the follow-up was for the child. So now I want to mention just a couple implementation changes that are with the second edition. The first is prematurity. So this is a difference. You should calculate adjusted age for children who are born 3 or more weeks premature up until they're 2 years of age. So this is the same guideline that is followed for ASQ 3. So we think that should make it easier for people to implement. And the reason for adjusting, so all the norms and cutoffs were established when children were premature, the authors during the norming process did adjust their ages. So they were using younger questionnaires if needed. So in order to get the accurate results, you should make sure you're using following the same guidelines for any premature children that you work with. And they found that they decided to do this because not correcting for prematurity could over-identify some of the younger kids who have regulatory concerns, like sleeping or eating, that if they're significantly premature just haven't been worked out yet because of their prematurity, not necessarily because of a social-emotional difficulty. So they didn't want to over-identify those kids, so they wanted to make sure to adjust the age. And there will be, we have an ASQ calculator on our website, which is agesandstages.com. It's a free calculator. We're updating it with ASQ SE2 questionnaire intervals next week. So you'll be able to use that. That'll calculate adjusted age and chronological age for you, and it tells you which questionnaire interval to use. And we're really excited that by the end of the month, we should have an app out, a free app that you can download. It's first going to come out in the Apple Store, and then we're going to have an Android version come out probably in another month. But that app will help you identify which questionnaire to use. And it also it'll also help you do adjusted score, which we'll talk about in a couple slides. So scoring, interpreting results. The scoring indicators are unchanged. So the X, the V, and the Z stayed the same. The item scores are unchanged. So you'll see this are often or always is either a 0 or 10. Sometimes it's always a 5. Rarely or never is either a 0 or 10. And the concerns are a 5 as they were before. What's different is that there's now 3 possible results. They are very similar to what was before. So above the cutoff indicates the need for further assessment. The monitoring zone indicates a need to kind of watch the child, or if the child's a girl, or if there are other family concerns that you may want to refer, you're welcome to do that too. And below the cutoff indicates that development's on schedule. And then the final implementation change that's important to note is about how missing items are handled. So omitted items when a parent turns a questionnaire in and their items that weren't filled out. So these guidelines are much simpler than they were for the first edition, which is nice. So all of the questionnaire intervals are handled the same. So before, the number of questions that could be missing were based on which interval it was, but now all 9 intervals, 3 is the max numbers that can be missing. So if a parent's filled it out and you're missing 4 or 5 questions, it can't be scored accurately. And parents, of course, can be omitted for cultural reasons, or if there's a reason specific to a certain family, you're welcome to omit them. In most cases, you're not going to need to adjust scores. You only need to adjust scores if there are 3 items missing. So if there's 1 item or 2 items missing, you don't need to worry about adjusting the scores. But if there are 3 items missing, you need to check to see whether or not the child's score is within 5 points of the cutoff. So I think on the example on the handout here, so the score is 65. So if the child's score was 60, you would need to adjust the score. But if the child's score was 80, you wouldn't need to adjust because it's not going to affect the result. Or if the child's score was 15, you don't need to adjust because it's not going to affect the result. It would just, whether it's 5 points within this cutoff score or 5 points within the monitoring zone. So if they had a 45, missing the questions might tip them into the monitoring zone. And if they had a 60, it might tip them into the referral zone. So you only need to worry about it if it's 3 items are missing. So you're probably rarely going to have to adjust for score. But our new ASQ calculator app and the website calculator will both adjust the score for you. So if you go to the calculator and you type in the results, it'll tell you at the bottom you don't need to adjust the score. So probably about like 90% of the time, even if 3 items are missing, you probably won't need to adjust the score. And the adjusted score happens, so if you do have to adjust the score and if you do have to adjust it by hand, there's detailed instructions in the user's guide, and it's the same idea of how you adjusted the score for the first edition. So you calculate an average score per item, and then you multiply it by the number of missing questions and add it onto the final score. That's how you get the adjusted score. But that's all outlined in the user's guide if you would have to do it by hand. And I think it also talks a little bit about it, how to do, on the Quick Start Guide, it mentions that you need to adjust. All right, so those are the final changes, and now I'm just going to show you some of the products, which is some brief descriptions. This follows the same structure we've been doing for ASQ3. So we sell a starter kit that has your box of questionnaires, your user's guide, and a free quick start guide. These boxes of questionnaires come with a key code, and the key codes unlock the questionnaires inside an ASQ Online subscription. I know there are many ASQ Online users in Kansas, so that key code will unlock this new edition for you when you type it in. And there's a little more information on that later. This is an image of what the ASQ2, the English questionnaires look like. Just a reminder that there is a CD-ROM. So the paper versions of the questionnaires are in the box, so you can photocopy, and the CD-ROM has all of the questionnaires, all of the item response sheets, all of the social-emotional guides and activities, and then I think it has the parent conference sheet and the ASQ SE2 handout are on there, too, for photocopying. There's an image of the Spanish box. So when you order the Spanish box, you get a Spanish quick start guide for free. We included that since we don't have a Spanish user's guide, and we wanted to make sure that if people were using the Spanish box that they had, and they were a Spanish speaker, that they had the basic implementation instructions. That comes free with the box. And there's a separate key code for your Spanish questionnaires. The user's guide. This comes with the starter kit, but you also can order it separately. It has chapters on how to set up your screening program. It has chapters on implementation and how to be culturally sensitive when you're working with families from different cultures. There's lots of samples and letters, just like there was in the previous edition and in ASQ3. One thing to note that's different that I wanted to point out, in the appendix, there is a 4-page guide that's designed specifically for healthcare providers. It can be photocopied and shared with providers. If you're sending the child's results, you might want to send a handout to the physician just in case they're not aware of what ASQ SE2 is. So this 4-page handout has information about the background information about the tool. It has some guidance on how to interpret the cutoff, and then it also has some recommendations for how to interpret the results and what some possible steps that the physician might want to consider next. So that's a new resource that we added to this edition, and we hope it'll help facilitate collaboration with physicians, between early childhood practitioners and physicians. We have an ASQ SE2 Quick Start Guide for the second edition. This is new. The first edition did not have this. They're 4-page folded guides that are sold in packs of 5, so you can buy them. You might want to only buy, say, one user's guide for your program, but you might want to buy a quick start guide for all of the different people who are going to be working with parents and scoring questionnaires. And so it has really clear directions on how to choose the right questionnaire, how to introduce it to families, how to score it, interpret results, and then how to communicate results with families. It's very similar to the ASQ3 Quick Start Guide if you're familiar, the same concept. And that the Quick Start Guide comes in English and Spanish. So we have 2 exciting forthcoming products that are coming. We are going to be revising the ASQ SE Practice DVD, and so that's going to be out in winter 2016. It'll have information about the new monitoring zone and screenshots of new questionnaires. So that would be good, especially if you have new staff that are coming on board. Showing them the DVD is helpful. We're also excited to be working on ASQ SE2 learning activities. We're going to follow a similar format to the ASQ3 learning activities with the book and a CD-ROM, and these are activities that you can share with parents. You know, a lot of home visitors find these really helpful. You know, they work well for kids who fall in the normal zone and then also kids who fall in the monitoring zone. They're great activities to give so the parents can work at home with the child. There's also some tip sheets on eating and sleeping and toileting, which are big issues and worries for parents. So having these tip sheets we think will be really helpful. These are different, I'll say, different activities and different tip sheets than are in the user's guide. This is kind of a whole book that's similar to those 20 pages from the user's guides, like more in-depth. So that'll come out in both English and Spanish, and it'll be available next summer. So for ASQ Online, that's our online management system, the ASQ SE2 questionnaires will be available by the end of this month. We're doing the final testing now, making sure all the reports and the questionnaire entry pages look good. Each questionnaire box has the key code on that inner flap, and that unlocks all of your questionnaires and then all of the letters and activities as well inside the system. So people who are existing users that are using the first edition, they'll be able to keep using the first edition until January 2017. So if you're a program that you're going to transition slowly, or maybe you'll find some old ASQ SE first edition questionnaires, paper ones that you didn't get entered into your system, you're still going to be able to enter in the old edition. And even after January 2017, all your access to the previous data that you've entered will still be there, and you'll still be able to like see reports on that. And if you wanted to look up a specific result for a child, say from 3 years ago, you'll still be able to see that result. You just, after January 2017, won't be able to enter any new questionnaires in. And you will, if you're a program that's transitioning, you're going to be able to enter ASQ SE first edition and ASQ SE2 questionnaires at the same time. So say you had one home visitor who was using the first edition with one family, but then another home visitor she already has her new photocopies to work with families, and she's using 2. That'll be okay. You'll be able to do that if you want to do that. So that is the last slide I had. I just wanted to put up a link to our website. Last March, we launched a whole new website that has a bunch, we tried to add a lot of free resources on there. There's a whole resource library under the free resources tab that you can go in and you can search. Say you want information on implementation on ASQ3, and you can use the filter box, and it'll pull up every conference presentation on it, or any handouts we have, or any newsletter articles. So that's really a great way to find some resources. We also have all of our newsletter articles are archived there. We have a bunch of case stories and our calculators. So now I can turn it over to questions.
Okay, we're going to unmute everyone's lines here, so please try to be conscientious of that. Any background noise?
No. Let me think. 3.
Do you have anyone that has any questions?
11. Bye.
Anyone that has any questions?
Is there anything in the chat box? Or
We don't have any in the chat box right now. That's another way that you can go ahead and do that.
This is Maureen. Can you hear me?
Yep.
You pretty well answered the questions that we have, but one question I do still have is we have some ASQ SE-2 kits yet. Will we get if we send them back into Brookes Publishing, do we get a refund?
Sam, I don't know if we've talked about that in sales or not.
Yeah, unfortunately, that is not the case. We can, if you'd like to chat, I can give you my, let me give you my cell number and we can chat, 913-749-6954. Do you know, how long have you had the SE? Was it something that you purchased within the past year, or have you had it for a while?
No, it's just something we purchased within the last year.
Okay, yeah, give me a call and I'll see what we can do. I know we can't take it back, but I might be able to work out some sort of compromise with you.
Okay, thank you.
Sure.
Any other questions?
Let me just ask an unlearned question. This is Kim Bohr. Amy, from what I understood, basically, if someone were, all this stuff's been loaded up into the enterprise system, which permits us to kind of get a broader population understanding of all the enterprise system users. If I followed this, any trends in the population that have been shown by the first edition, it's going to be consistent information then that gets filed from the second edition. I mean, it won't have to be adjusted for any reason.
Well, the reports will be similar. So there's some reports that show whether the child's like above the cutoff or below the cutoff. And so that report would exist for the new edition. I think they're going to be separate reports, though. So if you wanted to run a report on all of the kids that were screened in the last year, there would be one report for the first edition and one report for the second edition with ASQ SE2. So it's not going to, I haven't seen all the reports laid out yet since they're still pilot testing everything. But from my understanding, they're going to be two different reports. So you're actually going to get, like, I guess, 8 new reports added. Does that help answer your question?
I think so, but you're saying that even though there would be different reports, a researcher could compile them and have apples-to-apples kind of results pre and post the new edition?
Yeah.
Okay.
And they are all exportable in a CBS file, so you could export them and then, like, copy and paste them together and then look at them in Excel.
Okay. Looks like we have a question.
Yep. It looks like Debbie's asking, will trainers be provided the new training materials for this new version?
Hi, this is Carolyn Burke. And we had agreed to send the people who went through the kiddos pilot specifically the training materials for the new version, but it will be limited to those who went through kiddos training only.
Thank you, Carolyn.
You're welcome.
Carolyn, this is Kim Moore then. Will people, you believe that the receipt of the materials is adequate, or do you see a need for some small additional training for people?
I believe after having attended the ASQ Institute in August that with the new training materials that they will receive, as well as several of the documents that Amy made available today that express the changes to the questionnaires, they will be able to go out and train with fidelity without compromising, without having to attend any additional training.
Thank you.
And
You're very welcome.
We also recommend, the implementation chapter in the user's guide would be good for people to read. That kind of outlines, has more detail about the implementation changes that I talked about today.
those were my biggest takeaways from the training. Is the changes to the questionnaire are pretty self-explanatory. You just follow along by number. But the implementation changes, just the addition of the monitoring zone, the addition of referral considerations and other items such as that we went over earlier really will make a big difference in how people train, just the information that you want to make sure is available to them.
Any other questions?
Oh, I'm an ASQ SE trained person, so and I understood most of it. I don't think I could actually screen it. It seemed pretty clear and straightforward to me, and it seemed like you've done a lot to make it implement, and to some degree, I think you've done some improvements that ought to make it more user-friendly. Especially, I don't know, the materials available to parents. You don't have any sense that there's anything about this new edition that limits the people who are capable professionally of doing the screening, do you? I mean, is this hasn't now become a tool that only social workers or doctors can use? You still believe it's a tool that a broader group of people can screen?
Yeah, certainly. So the changes that we made were really only to make it easier. There isn't anything that made it, more technical or more difficult. And yeah, the authors really feel strongly that, home visitors and child teachers, are able to share it with parents and score it and talk with them about results.
Thank you. Well, Katie, anything else before we let Amy go? As we said earlier, this is kind of a central portion of our regular quarterly call with our learning community, and so we're happy to welcome others to stay on the call. We're just going to finish up with some project reports, and for our friends at Brookes and others, these projects are working on a community or regional basis to make ASQ SE universal screening, and so we're kind of hearing reports, and I think we now know we can talk to Maureen, so I think she's the one left. And we do have a few announcements about some other things that are going to be available, so anybody's welcome to stay on, and we want to thank Brookes for being with us today. We sure appreciate it.
Thank you.
Thank you for having us.
And Kim.
And I wanted to. Excuse me, this is Sam, and I just wanted to get my contact information again. I live in the Kansas City area, so and Katie has my contact information, as does Debbie Richardson. But please, if you have any questions at all, feel free to call me on my cell, 913-749-6954.
And Kim, this is Debbie Richardson with Kansas Department of Health and Environment, and I also want to express my appreciation for you and then also Amy and Sam and Carolyn at Brookes for all the support you provided to the Kiddos Initiative, and thank you for allowing us to share this wonderful webinar today. Thanks so much.
You're entirely welcome, and we have recorded it, and I suppose within 24 hours or so, Jeff will make it available on our website, which is just healthfund.org.
I'll send the link out as well, just so people have that. I'll send that to Betsy, and then she can distribute that out to everyone else. So.
Yes, we appreciate it. Have a great weekend, all.
Thank you very much. It sounds like we have quite a few that